Can you state your name
Sure, I'm Summer Martins.
and who do you work for?
I am the research manager of the section of family planning and contraceptive research here at the University of Chicago in the Medical Center.
So tell me a little bit about the work you did on this app and the research.
Sure, so I can explain some of the background
Okay.
to the app. So this app project stems from some current research that we have where we're looking at factors that affect women's access to contraception in the clinical environment. And we identified barriers in a few different areas that we then addressed with the app. So one thing we noticed that young women arrive at the clinic with maybe not as much knowledge of the contraceptive options or some misperceptions that they've heard from friends or family, maybe even other physicians or social media, the internet. There are multiple sources of information that inform women's perceptions about contraception. So that was one thing we noticed. And then we also, of course, recognized that there are time constraints on care that's provided in the clinic. You know, things need to be very efficient, move very quickly, and so there's limited time for patients and counselors or providers to have that conversation about what options might be best for women in terms of contraception.
Okay.
And then we also noticed the amount of time that women spend in the waiting room. Like there's some downtime where maybe they're on their phone, or there could be pamphlets in the clinic, but I think people in general, and especially young people these days, aren't really accustomed to learning information just from kind of a static piece of paper.
Mm-hmm.
So those are kind of the three ingredients that really informed our decision to develop an intervention that uses an app. And the app is actually designed to be used by patients in the waiting room while they're waiting for their appointment. And it reviews the different contraceptive options that are available to them. It features some video testimonials from real users. And then there's an interactive component where they can explore the method that's most interesting to them. So it provides this interactive experience that hopefully prepares them better for that counseling session they have with their provider. And so that conversation is just more efficient, and it hopefully leads to more empowered decision making by the patient as well.
Well, that's great.
Yeah.